They requested him to come. He gave it $2,000, $100,000. Telling
Balu door dekho.
All move to that side, center.
Participants ఇక్కడ విడిగా ఉండమన్నాను. మీరు వచ్చేది మీ పిల్లలు వచ్చి మీ జోన్ నెంబర్ చెప్పండి. జోన్ వాడి నెంబర్
అదే స్టూడెంట్స్ రిమూవ్ చేస్తారా?
రాసుకోండి, కూర్చోండి. ఎలా పోతుంది వెనకాల అయిపోగానే లాస్ట్ డ్రా చేయాలి కదా. ఇక్కడ కూర్చోండి. చిత్రండి మీకు ఇక్కడికి వచ్చినా పర్లేదు. బాగున్నారా? నైస్ నైస్. కష్టం మానుకోకూడదు. ఇలా కొంచెం రామప్రసాద్ కి ఇన్ఫర్మేషన్ ఇస్తే తప్పకుండా ఏపీ ప్రోగ్రామ్ దేనికి మాండు. అది దట్ ఈస్ హిస్ కమిట్మెంట్.
We used to call Miller bombs. Patabi.
Health investigation from that status to students as well as junior doctors, everybody is connecting there. So for all of us, our goal is health. Health is we are promoting health to the public. So World Health Day is very important day in our medical fraternity. Today we are celebrating this function. So Indian Medical Association state they wanted to conduct an elective competition for all the medical colleges are existing in Andhra Pradesh. So quite a good encouragement came. So many people came, and postgraduates, undergraduates, and other people also they came and they participated in this one. we divided all these things in 3 zones. So from these three zones we conducted the elections. So before this one, I wanted to invite the guests onto the dais. So I request our president of IMA stage is Dr. Balar Garu, because he is unable to come and examine some important work over there. He requested me to invite the vice president of our state. Our Dr. SIMS&RF is the president of present program. I respectfully invite him to come on to the dais. Dr. SIMS&RF is the game doctor here. He is doing practice since a long time. Sir, please kindly take your seat. Now I request Dr. Chandrasekhar, our Vice Chancellor of the Health University, the great man, please come on to the dais. Next, the great man and strong man and a noble man and a philanthropist, Director General of Benevolence Siddhartha, Dr. C. Nageswara. Please kindly come and take your seat, sir. Now I request Andhra Pradesh Medical Council Chairman, Dr. Sringar Rao Garu. He is the person who is doing everything for great help to our medical practitioners. Now I request the great old friend of mine, Director C.V. Rao Garu, to come on to the dais. Sir, when sir, at least now also. Now I request our program coordinator, Dr. P.S. Sharma Garu, and he is the president-elect of our AP state. Now I request Dr. Bhimeshwara Garu, the principal of this medical college. Please kindly come and join with us, sir. With this introduction of all the dignitaries onto the stage, now we will start this one with the IMA prayer. Please kindly stand up, everybody, and put your hand like this. I will read the prayer. Please kindly repeat that one. May everybody be happy. May every one of us see to it that nobody suffers from any pain or sorrow. I do not ask for crown, nor I wish to be in heaven or heaven. I only want to elevate the suffering of those people who are burning in fire of sorrow. Long live IMA. Jai Hind. Thank you very much. Please kindly be seated. Now I request my president to give his opening remarks. Dr. SIMS&RF.
Yes, Chief Guest, Vice Chancellor and Health University, Director, Benevolence Siddhartha, Chandrasekhar, Medical Council Chairman, US the Principal, and Dr. Bose, Secretary, IMA AP State, and Dr. Sharma, coordinator of this program. I am Dr. SIMS&RF, Vice President in Indian Medical Association, presently practicing for the last 40 years in Vijayawada as an ear, nose and throat surgeon. The purpose of this quiz is not a competition, it is sharpening the clinical thinking and enjoying the process of learning. It is enjoying the process of learning. To stay curious, competitive, and clinically smart. I appreciate and congratulate all the members who are participating in this quiz. Here, whether you win or lose is not the matter. It is the real success lies in the knowledge gained through this program. I wish the participants will deliberate their views and the whole audience will enjoy the program. Thank you.
Dr. to give this valuable message to the audience. Thank you.
President of IMA, the senior members of the IMA, and the Honorary Secretary, and also the Subhash Garu, and also the APMC Chairman, Dr. C.A. Rao, Bhimeshwar Rao, former Vice Chancellor of Indian Health University, Dr. C.A. Rao, and other invitees of IMA, and also my dear students. So it is a great privilege that NSS is coordinating this one. I am happy today I come over here and joined as for the World Health Day celebrations at Pinnamaneni Medical College. And I think every year there is a slogan of World Health Day. The slogan this year is Together for Health, Stand with Science. So this is a slogan that this year they have made, and everybody should be very health conscious. And as you know that different World Kidney Day, World Diabetes Day, World Health Day is held on this 7th April. And I'm a cardiologist. Worked a long time at Karnal Medical College, and I was instrumental in developing a founder secretary to the Karnal Heart Foundation for preventive cardiology. In 2002, I started this one. From 2003 onwards, regularly World Heart Day has been conducted. As you know that World Health Organization is divided, has made most of the programs. I'm happy that IMA, Indian Medical Association, is the largest association. So when because it is a democratic world, India is almost growing in population. We have become the number one in the entire world. So I think the IMA has done a very good job. And I think we have instructed all the NSS teams, all the medical colleges to conduct a World Health Day, because by conducting this, like World Heart Federation has been doing the World Heart Day from 2000 onwards. So the idea is basically to get awareness. So like prevention is better than cure. So I'm happy that Pinnamaneni Medical College under the dynamic leadership of Anais Garu, also C.V. Rao, and also Bhimeshwar Rao are doing this program, and I'm happily associated with this. I wish you all the medical college students, both undergraduates and postgraduates, utilize the opportunities, and you should attend to the regular CMA programs. And the university is in the forefront in terms of whatever academic research is concerned. We are putting almost 13 crores every year for the research fund, both for undergraduates and also the faculty research grants. We are also encouraging the sports and also alumni of the different associations. So those are students, those studied in that particular medical college, they can also come and contribute both academically and also on a monetary wise, how best we can improve the institution. And the Pinnamaneni Siddhartha is the oldest institution, I think, celebrated in 50 years golden jubilee also. So definitely this goes in a long way. I should wholeheartedly appreciate IMA team. The greatest stalwarts are there because I've been seeing Sharma Garu coming to the university, sir, will conduct through this and from the university. I've been helping send all the whatever education and all. At this age, I think they are doing a very this one, and we should update the knowledge. If you don't read the latest journals, your knowledge goes back to 1 year. If you don't read the latest textbooks, your knowledge goes back to 10 years. So remember this point, and the doctors as the doctors, we should continuously learn until the time of death, we have to learn for the patient care. So with these few words, I thank the organizers who invited me for this lovely World Health Day celebration from the Medical College. Thank you.
Very inspiring speech which you have delivered for the young doctors who are collected over here. Now, I request our Director General of the SIMS&RF Medical Institute of Medical Sciences, Dr. Nagesh, to give his message to this honorable.
Om Namo Venkateswaraya. All the guests who have come all the way from Indian Medical Association to our institution, we welcome you and thank you for coming. And also all the students, fellow students, staff members, everybody. So we thank you very much for coming. I think I was listening to most of you who have participated in the online program, what we have talked. So you imbibe quite a bit, and also you remember that. Now you are going to see you talk it, and without any, in your hand, anything is there. Actually, the slogan, the thing is that global action for universal health coverage. I wanted to say that all of us, we want to be healthy. What is spell healthy? H-E-A-L-T-H-Y. What are the first four letters? H-E-A-L. Here. What are the three left behind? T-H-Y. Die. In biblical language, die means yourself. Every human being should take care of their body, activities, everything, and they will heal themselves. That we never, somebody tell us that say, in healthy there is H-E-A-L. Is it right? All of you know before that? Never thought. So this is one thing where we have to see. We have to work out and see how first thing you have to explain to all the people who are coming to the hospital what they have to be healthy, then how to take care of it. So, I don't want to take much because let us hear the youngsters talking about what they are going to do. Then you have to work hard to convince your patient. Patient is your customer. So customer is very important. It's not for them, it's for us. We should know what they have, what to prevent. Prevention is not care, prevention is cure. Prevention is cure, not better than cure. Prevention is cure. If there is no disease, there is no need for cure anything. So, how to invite all this to the patients that come or regular healthy people to come to be healthy, and this is the important thing where all the IMA should become strong. Similarly, in America, the American Medical Association dictates the president. So we don't have that power because there's a large volume, not so many doctors, so many people. They go on strike, what will happen? So we have to be united. We have to unite our residents, our doctors, students who are coming to our medical center and teach you all the ethics and compassionate to the patient. And that's what I would like all of you to take home with you. And let's all listen to the youngsters, what are they doing here. God bless you. Thank you.
Nageswaran, your most appropriate speech regarding World Health Day. I think it will inspire all the young birds who are standing over here. You should be united and you should strengthen Indian Medical Association. As Dr. Nageswaran told, almost all in the world, medical associations are very, very strong, except in India. So, when our strength will increase, definitely our IMA also will become very strong. Then we don't have any problems in future. So, thank you very much, sir, for your inspiring speech. Now, I request our APMC chairman, Dr. Srihar Rao, please come and give your remarks. Thank you.
Good evening, everybody. Today's presiding officer, President Dr. Pinnamaneni Sharma garu, our beloved and dynamic medical administrator, our Vice Chancellor, Chandrasekhar sir, and visionary leader and Director General of this college, Dr. Nasir garu, and former Vice Chancellor C.V. Rao garu, Principal Dinesh garu, today's organizing this function, our General Secretary and Senior Leader of IMA, Bose garu, the man behind this program, and every day he is trying to lift the IMA, that is the Dr. P.S. Sharma garu is the President elect for the Indian Medical Association. First of all, I wish you all for the World Health Day today. And WHO this is the anniversary of the World Health Organization. And every year we are observing this day on 7th April. Generally, we are celebrating with every year World Health Day, focus on a specific healthcare problems and the solutions for this problem. This year, we are concentrating on the together for health and stand with the science. This is the motto of this World Health Day. And as all of you know, AIMA is the largest organization in the world. And we have the 4 lakh members and 1,780 branches all over India. So AIMA is a multifaceted, multifunctional organization. They are conducting regularly the continuous medical education program and healthcare awareness programs and all. Whatever it is, this is the IMA, the mother of all our doctors. So we congratulate at that outset, I congratulate the team, Dr. Sharma garu for organizing this World Health Day the celebrations. And as all of you know, universal healthcare is an active universal health coverage, including financial risk protection and assess the quality essential health services. However, challenges persist such as funding gaps and unequal access to healthcare and impact of climate change on the health system. And all people have the equal healthcare services without the financial hardship to the people. Main concept is the universal healthcare to reduce the financial hardship to the poor and needy patients. The essential healthcare services are the promotion to prevention, treatment, rehabilitation, and palliative care. Every country and state have different ways to achieve this universal healthcare. So, in our state also, our state government is planning to cover all the people under this universal healthcare. So today we are listening to the young person. They are almost selected all members they are winners of this entire 3 zones, 4 from each zone. So I request our participants to mainly give your solutions and about to what are the things you need for the universal health care for the poor and needy people. So I request them and I thank the organizers for giving this opportunity. Thank you.
For kind presentation of Health Day remarks. Really is quite wonderful, nice. Is it possible for our director come on to the stage and give the speech of senior author? I request you. Thank you, sir. But you will bless, your blessings always will be there. Now I request my program director, Dr. Sharma, who is the man of action and he is the person who is behind this program. I welcome, sir. Please kindly give your remarks.
Good afternoon, everybody. How are you? Fine. President and dignitaries on the dais, and my dear students. A wonderful location, a wonderful occasion, a wonderful reception, all put together in World Health Day celebration at Pinnamaneni. That is today, 7th April 2026. I am happy to inform you that this year, under the dynamic leadership of our President Dr. Raju, we have taken up 2 new initiatives. Number 1, e-poster contest on the World TB Day on the theme Unite to End TB. We had a good response from all over the state. 40 posters have come and we have given them the prizes. Number 2, electrocution contest for all the colleges in 2 rounds, because geographically we have Zone 1, Zone 2, Zone 3 in Andhra, total state of Andhra Pradesh. We have finished the preliminary rounds of all the 3 zones online. Here also 40 participants registered, but unfortunately only 20 participated. Maybe stage here I don't know. Only 50% participation. And out of the 20, we have selected 12 people, promoted them to the finals. That is today. We are going to have the finals live. So, this is the second initiative, and here I will tell you that our Vice Chancellors are here. The moment I requested him to send a mail to all the principals. Today I have sent a mail. The next day the mail has gone from his office to all the medical colleges all over the state, and that made us a good response for both the events. So thank you very much, sir, for your encouragement. Secondly, the venue. Nageswara Garu is very well known to me since many years, and I may recall my student days in Andhra Medical College when Pinnamaneni Garu was the principal of the college. Way back in 1962. 62 to 68 in the medical career in Andhra Medical College. At that time, Chad was the principal. So, we have his blessings for all the programs. Sir, we thank you very much for your patronage, for your support, for your sponsorship, and in future also we will come to you with our many programs, with the blessings of Vice Chancellor, with the blessings of all of you, and with the blessings of all our active FDI headquarters, Andhra Pradesh. Friends, I am very happy. One important point I want to tell, especially to all the youngsters here. I see all the young faces, all the students too. Please do participate in all the activities. College level, inter-college level, university level, and also the conferences. Participate in the poster, participate in the quiz, participate in the paper presentations. That will give you a good confidence and you have a chance to win the prizes also. And IMA will definitely continue to do this program. Encourage the youngsters because you are our ambassadors. Our battle is over. Our battle is over. You people, you are going to do the healthcare delivery system to the community for the coming 50 years, 50 minimum. So, be on the job. Be a beautiful doctor, whatever it is, whatever specialty you take. And finally, my association with Pinnamaneni. And in these two programs, Pinnamaneni representatives have done a good job. And incidentally, I may tell you, IMA CGP, we have the academic wing of IMA College of General Practitioners, which is taken up all the academic activities from time to time. And in the last 3 years, we have been conducting a diabetology certificate course. 3 batches, 2 are over, third is going on at Kakinada, and 1 batch at Vijayawada. And Dr. Jawahar is the faculty for Kakinada program. And right now we have our Professor Ishwar sir. We are very thankful to you. He is our chief faculty for the Vijayawada batch. The moment Dr. Ishwar's name was there, 54 institutions were there. 54. At Kakinada, only 40. Whereas Vijayawada 54. So we are very thankful to you, sir, and Dr. Ishwar. And because there is another association in Pinnamaneni. Again, your blessings are there with us. So, my dear friends, so this is I want to emphasize here. And lastly, I think we'll be shortening the presentations very soon. Maintain perfect silence, no disturbance. Don't look at your phone. Take a photograph, no problem, but don't look at your phone. Keep it, no disturbance, no discussion, no halla. Perfect maintenance. It is all the 12 participants are completed. That is 1 hour minimum. So, if anybody wants to go in, now itself they can go. But those who are here, perfect maintenance, perfect discipline. That's very, very important. And I will be briefing all the participants in a very short time. Rules are the same, topic is the same. So, there is nothing much to tell you. Only thing is, you have to draw the lot, who is coming one, who is second, who is third. That I will be telling. And we will be keeping the time and we just will do that now. After that, all the 12 participants have participated initially. Within 5 minutes, we will declare the results and we will give the award presentation for this also and also for those people who have missed the bus at about the quality e-master contest that also will be distributed now here. So with this, once again, I thank all of you and also especially thank all this management, AO and also all the other people who have helped us in the program from time to time, and especially Nageswara Garu, Vice Chancellor sir. Thank you very much. Thank you very much. Thank you very much.
Presiding officer, Vice President of the IMA, Dr. Pinnamaneni, Chief Guest, Dr. Chandrasekhar, the Vice Chancellor of India University of Health Sciences, other dignitaries on and off the dais, participants for this elocution contest, and my dear students. Again, good afternoon to you. On this World Health Day, I am happy that the Indian Medical Association of Andhra Pradesh has chosen our place to conduct this elocution contest. As Dr. Sharma has told you already, how this elocution contest is being conducted, and the 12 finalists who have come will be presenting live here. I wish all of them best of luck for this elocution contest, and I do not want to stay in between you and the elocution contest. Thank you very much.
Lastly, it is my turn to talk to all of you as a General Secretary of the IMA State. Really, this function wonderfully done because respected Vice Chancellor Dr. Chandrasekhar, Director General of Siddhartha Institute of Medical Sciences Dr. C. Nageswara, and APMC Chairman Dr. C. Hari, and Program Director Dr. Pinnamaneni, and Principal of this college Dr. P. All these people, I am very, very respectfully, I bow my head for coming to this occasion and bless the IMA. Thank you very much, sir. All of you have given a very good message to these people and birds here. World Health Day, we are celebrating this every year on April 7. This year also we are celebrating. This has having some importance because of the slogan which you have read. See, what is that one? Together for health. Stand with science. It's a wonderful message. ఆరోగ్యం కోసం మనందరం ఐక్యంగా ఉన్నాం. విజ్ఞాన శాస్త్రానికి అండగా మీరందరూ ఒకసారి అనండి. టుగెదర్ ఫర్ హెల్త్. ప్లీజ్ స్టాండ్ విత్ సైన్స్. ఈ స్లోగన్ అనేది మీరు పట్టుకోకుండా దీని ద్వారా ఫ్యూచర్లో మంచి డాక్టర్స్ అయ్యి మంచి పేరు తీసుకొస్తారని ఆశిస్తున్నాను. సో IMA is the organization which stands for the medical fraternity, especially allopathic doctors. World Health Day is celebrating not only for doctors. Whoever is doing help to this, what you call for the health of the public, like even the paramedic staff, any other people who are working in the laboratories. So those people also will stand for this World Health. So we should remember those people also. Especially what our APM's chairman told about whole India. I am telling you about our own state first. See, our own state, we are having about 23,000 doctors are the members of this IMA. But whereas 75,000 doctors are registered in the APMs, what happened to the remaining 50,000 doctors? Where are they? Why they are not running? It is a very wonderful question. See, if numbers are increasing, our strength will increase, our stand will increase, and we will be remembered by everybody. So, my request, all the young doctors, please kindly join with IMA hand in hand and strengthen it, so that if there is any problem, we can solve it very easily with the government, with the public, anything. See, first thing, foremost thing, what we should learn, health fighting is, all the doctors should be having a good relationship with the public. Without public, you are not there. Public, if you are having more and more amicable with the public, that will definitely give a good name, what you call a good system. So when we are young doctors, our relationship with the public is somewhat better than what we are doing. Because nowadays, we are hearing every day some violence or something like that. Why it is coming like this? Some gap is there, definitely. So, I might request all doctors should learn the public relationship, to try to conduct certain things without expecting anything from the public. See, for example, human papillomavirus, we conducted so many training programs, but attendance is very, very poor. See, that should not be there. See, regarding this one, you should be going to the girls' schools and awareness programs you should conduct, so that we should convince the parents of that particular girls, babies to get a vaccination. You should be in a position to tell them it is very good. It will be helpful for your girl in future. So this sort of programs, if you conduct in the public will have more and more affection towards our community, towards our fraternity. It will indirectly help everything. All these unnecessary, untoward actions will be come down. So that is my request. That is my personal request for everybody on this great occasion of World Health Day. Thank you very much. There are so many people came here on the dais, and before the dais also Dr. Prasad is there. He is the senior most physician. He has done a lot of service to Vijayawada. At the same time, Dr. You should remember all those people. See, of course, on the dais people, they are having their own greatness in their own bits. I am very, very thankful for listening to me very patiently, very neatly, very quietly, very silently. Thank you very much. Jai Hind.
Satyanarayana Chandra came to our office and all that a few years ago. And then he came recently. But the last 4 months, I think I should have got every day a call from him. What are you doing? Who is the person who is always is so permanently thinking, maybe to think that I have to do something for this particular function to do. So then we have to, that should be tenacity that you should have when you want to implement what you want to do. You have to be after them, take them. Even fellow who is saying, you are sure you will do, but remind that what he did, sir, I mean, you really extremely, your tenacity, your persistence, you stay so well that I can never saw anybody doing that. Without that, we could have done. But you are more on your heart that we have to do this way. Thank you so much. Everybody should learn from you how you will get your things done.
Stage of this program on the stage. Now the other part of the program is start. That is the electrocution competition. Those people who won in the zones, they came physically here. They will talk. Then once finished, then we will distribute the prize. Thank you very much.
To be on the other here. Now all the 12 participants will come over here. All the 12 participants please come over here. All the 12 participants. I have chips with me with the numbers 1 to 12. You pick up your number and that will be noted down. That will be your code number. That will be the order in which you are picked up. Okay? So now, you are turn around. Turn around. 1. Only 1 tip for 1 person. నెంబర్ తీసుకున్నారా నెంబర్లు కొట్టాలి. Timekeeper. Each participant will have 5 minutes time. At the end of 4 minutes, I stand up to indicate that 1 minute is more. At the end of 5 minutes, I sit down. That means time is over. You have to close up. So time management is one of the items looked after by the judges. So you also observe them because you people have to do the job in future. So observe them how they are doing and try to participate in all the future events. Now, I request code number 1. Be ready.
It's my privilege to stand before you in this auspicious day to talk about global action on universal health coverage. It's a very neat topic today. So because of this topic, I would like to tell a few things about that. Why the health is global. Why health is global. WHO emphasizes that health is global responsibility. Why global responsibility? Why it is global responsibility? There is so many things to tell. If anything happens anywhere in the world, there is a cost, a threat everywhere. Because technology and talent and traveling turn the world into a global village. So that any epidemic in world industry, if it happens in some way, it takes months to years to spread over the countries. But nowadays, if any breakthrough occurs anywhere, it takes only 36 hours to reach our world. Because viruses do not need passports. That was proved in COVID. And bacteria do not stop at the borders. So still prevalence of tuberculosis in certain parts of the world, that's a great example. Even now also we can see tuberculosis in certain parts of the world. Due to bacteria do not stop at borders. So diseases are global, but healthcare is unequal. Okay. To emphasize this thing, I would like to give an example. In some countries like UK, if a child with thalassemia, suffering thalassemia, the child can get bone marrow transplant with the cure rate of 95%. Whereas if the same child is born in Ethiopia or Somalia, there even basic diagnostic tests are not available to diagnose that the baby is suffering with thalassemia, and even the baby may die without knowing what he had. there is very sad paradox of modern medicine. So, to combat this paradox, WHO, World Health Organization, launched in 2012 that is universal health coverage. Universal health coverage is the one which acts through three pillars. One is equity, quality, and protection of the financial burden to the people. So, with the three pillars of the action, WHO achieved so many wonders. So many countries enrolled in the WHO scheme, universal health coverage, and this adds to this coverage. Nearly 377 million people are cured with so many health services. Nearly 50 million people are survived from the falling into poverty. Infectious diseases are eliminated. Like that, so many wonders are done. So many countries incorporating in universal health coverage in their health systems and doing wonders to the people. Like our India, our legacy, and also Ayushman Bharat. These two are very famous and they are giving good health to the people, providing good health services. Okay, so the main aim of this universal health coverage is this is the thing. Everyone, everywhere can get health access. That is the main thing. Okay. Second thing, as a doctor, what is the response of the doctor? So, doctor should bridge the gap between the policies and the people. So many people unaware of that they are suffering with so many things and they are unaware of the facilities available to them. So, is the one bridging the gap. And what we are saying, health is not simply communicable disease, it is non-communicable disease. So, obesity is the biggest problem in this world. So, obesity, the main cause of obesity is the consumption of the ultra fast food like this. Okay, these are the packets you can see, you can buy anywhere, chips and potato chips, or sauces, or nuggets, or these are the ultra fast. These are the foods containing, if I read, you will be wondered, this 100 grams of packet contains carbohydrates 58 grams and total 31 grams fat and sodium 1132 milligrams. You wonder how it is, how bad it is. So, but we are taking very rigorously, regularly, and this causes diabetes, hypertension, even cancer, even early death also. So, at this platform, I request everyone from today onwards not see the front of the paper, front of the cover, always see back side. So, it's my appeal to everyone. Thank you everyone for this wonderful hearing. Thank you very much.
Are you ready?
Let me see, sir. Is it okay, sir? What I am speaking, voice is okay?
Okay.
Okay, sir.
Are you ready?
Ready.
Your time starts now.
Good evening, doctors and friends. My best wishes for WHO Day, April 7, 2026. Today is celebrated as World Health Day. And what is the theme of it is? Together for Health, stand with science. That gives a significance that together, research-oriented partnership is needed. That is together. And preparation for doctors to treat patients with evidence-based. So, together for health, stand with science. So, we have to stress for science. Now, the theme is this. And what is the theme in India? Theme is Seva, Sushasana and Samriddhi for India. Seva, Sushasana and Samriddhi. Now, let us come to the today's topic. My topic is universal health coverage. What is the global action going for it? What is the first thing? What is the aim of global action? Universal health. Why this? The aim is to ensure that every person gets good quality health care without any financial hardship by 2030. Then this is backed by WHO and EU. Now, what are the priorities? What are the things there? What is the priority of this project? First thing, strengthening the primary health care system. Secondly is developing and increasing the public financing for this. Third is reducing the out of expenditure by patients from their pocket so that to save
millions of people from poverty. Now, what are the key aspects? By 2030, another 1 billion people are to be added for this universal health coverage. Second thing is, improving the primary health. WHO and UNO back in the primary health centers. Why? When we were doctors practicing at the days, we were like family doctors with a very low cost used to pay, no much investigation, no much cost, and the patient used to treat us as God because that bonding was there. And they used to tell us as God, Messiah. Slowly this part is gone. And now primary health centers are come. Because why this gone is because of the increasing violence against doctors, Consumer Protection Act, and so many things have come. And we did not upgrade. I tell you, we have to upgrade to give quality medicine. So the primary health centers is a very important thing. And so strengthening of primary and now beautiful primary health centers are coming. There all the primary care is being taken. And telemedicine is also coming so that the specialist opinion also taken. And that is going to help this. Then financial protection, I told you, out-of-pocket expenditure we have to save so that so many people don't suffer from the poverty. Then USC Day. Universal health, it signifies accountability and accountability of the leaders that please invest in this. Accountability of the government, public, all that please invest in this so that we can carry forward this. Now, what is the role? What is the global efforts going on and what is they are doing in India? In India, we have Ayushman Bharat Pradhan Mantri Yojana, Ayushman Bharat Pradhan PMJ. It covers 10 crores of people with 5 lakhs of insurance for vulnerable families for secondary and tertiary care. Second is Ayushman Arogya Mandir. There are around 1,70,000 centers are there. They are focusing on primary care and prevention for non-communicable disease. Third is NHP, National Health Policy. This sets the goal for the nation to say that we have to spend 2.5% of our GDP for this. So there are a lot of challenges also there for this. What are the challenges? Workforce shortage, increasing population, rising poverty, mental crisis, data screening, and lastly is public readiness for this project. How the public will be ready? How will they trust that we are really doing it well? So what we have to do is, we have to educate people by keeping awareness camp, like so many camps are going on, HPV vaccination camp, like breast cancer, there are so many walks, radio talk, posters, seminars, and then putting up the free clinics like the Rotary Club, Lions Club, IMA. We have to reach the common people. Then only they will have trust in us. Yes, the people are really doing it for us. So we have to definitely make a trust in that modern medicine is the best medicine for us. And now, as you see, there are so many alternate medicines have come. This pati, this has come. So many diets have also come. From IMA Vijayawada, they published a chart, totally universal diet, what are the diets for diabetic, what are the diets for some other things. And so many patis have come. But we have to stress upon the patient, all the people, that ours is the science-based, evidence-based medicine for there. And this only can be developed when this trust will come to us. If we treat the patient with compassion, poor people, needy people, we have to have a compassion. Taking a degree and treating is not. We should have a heart to treat. Then only they will have a trust in our medicine. So I tell you, so many pati may be, homeopathic may be, naturopathy may be, but allopathy is the best one. It is science driven with evidence. And this allopathy can be best only if there are two things which are added to this. There are two pathis which should be added to allopathy. Allopathy with empathy and allopathy with sympathy. Thank you. Thank you.
Good afternoon to one and all present here, the dignitaries of the stage. I am Vinisha Sai Sankeet and I'm going to speak on the topic Global Action for Universal Health Coverage. So, on the occasion of World Health Day, that is 7th of April, the theme this year is Universal Action for Global Health Coverage. It is very, very apt considering the current geopolitical situation that anything which we want to do, the global implications of such actions are very, very limited because of the various wars raging on, various tensions across borders. And in these times, the theme is highly apt. What I encourage you all to see is how WHO and other bodies were active during the recently concluded COVID pandemic, how information was spread across within minutes, case reports published, and the conclusions derived, how the treatment was researched upon, the treatment modalities continuously changed, and the vaccine was invented. From there, even the supply of vaccines, India, our nation, stood ahead with the Serum Institute of India in Pune, manufacturing vaccines with Bharat Biotech creating its own vaccine and spreading it not just in India but across the world. When such bodies like WHO are to be supported, instead we are now seeing the bodies, especially with those with scientific backing, like WHO, being attacked by tyrannous world leaders. In such a situation, we have to realize the balance between geopolitical, globalization, and self-reliance. In these manners, India is very ahead, my friends. Atmanirbhar Bharat has produced many, many innovative designs manufactured in our own country. We have given Ayushman Bharat schemes, Arogyasri schemes in our own Telugu states, which are functioning wonderfully and meticulously well. We are seeing healthcare reaching across the societies, but I urge you all to look at the implications. I urge you all to see how efficiently these are functioning and who are the beneficiaries of these schemes. In an era where WHO is being attacked multiple times, we have to see where it is lacking. We have to see that we should be united, especially our young generation, where knowledge takes a backseat compared to certifications. We have to come ahead and see what we can do to increase the knowledge in our capability, within our capability. We have to check where we are. We have to see whether we are getting rewarded for our service. The era sitting here in front of me has provided their service selflessly, but our generation is not mindful enough of the fact that service is free for all. We need incentives. I urge you all to accept that we need incentives. It is not a bad thing in the current generation to need incentives. When we study for 5.5 years, do our PG, there is nothing wrong in asking for something in return. That is the mindset which we are all in now, and we need to accept that. We cannot reject that. We cannot say that it is wrong, but the world is everly changing. As we step into a new world where the scientists are being attacked, the doctors are being attacked, and recently, I don't know how many of you all have seen the article where our doctors are not encouraging their own children to pursue medicine. This is a very, very dangerous situation, my friends. I urge you all to see what we can do, what we can strive to do to change these circumstances. And we should, because when medicine is in crisis, as Sir has told, heal thyself is at risk. And that is something which we need to ponder on. As we walk ahead and as we open new roads, we see that there are more challenges being discovered. We have crossed many challenges in our past, but as we go ahead, there are new challenges being arised and new solutions need to be discovered. And bodies and scientific bodies like WHO, like Indian Medical Association, need to be at the forefront of these challenges. I conclude by paraphrasing a quote by Abraham Lincoln. Healthcare must be for the people, of the people, and by the people. Thank you.
Time starts now.
Arogyam Pradamam Bhagyam Swashasham Sarvada Sadhyam. Health is the greatest blessing and it is the tool to achieve all goals, and health is the greatest wealth. Good afternoon, respected dignitaries, judges, doctors, and all my fellow brothers and sisters. In 1948, the first World Assembly has met and decided and declared April 7th as the World Health Day, and today marks the 78 years of remarkable progress and the theme of universal health coverage, including promotion, prevention, treatment, rehabilitation, preventive care, and without financial hardships. And today, we can see there is an increase in aging population, increased non-communicable diseases, and climatic pandemics, conflicts, and mental health situations all facing a threat to reverse this process. And for this, all the nations have come together because health is not just a privilege, but it's a right. Because This creates jobs, drives economy, and ultimately creates a beautiful environment for our future. And for this, India's commitment for the vision for all exists since independence and firmly supported by the Board Committee and existed till today in the form of Ayushman Bharat, which is one of the world's largest health missions. And also we have Pradhan Mantri Jan Arogya Yojana, which is the publicly aided fund. And with all this, the core foundation for any universal health coverage lies in strong primary health care. And today, by strengthening the frontline services, skilled forces, and going to remote communities by utilizing community health workers, medical camps, resources, and interns, doctors going in field work, all this help because this ultimately creates affordable, accessible, and efficient health to everyone and everywhere. And women and men are equal in all aspects, but when a woman comes in a role of mother for nurturing the child is a unique stage. That's why child health and motherhood should take an utmost care, because when a mother is educated and healthy, generations grow strong and nation not only grows but also thrives. And also youth have a major role in this aspect, because by creating posters, conducting competitions as such, electrician competitions, creating videos, short videos, and educating the people and removing any myths. And also today there is no one size fit for all, because each country has its own path for its universal health coverage and its unique platform. And also today it is coming to one health zone where human, environment, and animal health is taken into consideration to eradicate zoonotic spillouts and climatic crisis. And today, the non-communicable diseases, we should go towards a healthier lifestyle, and change should start within us from our childhood. And any psychological therapy should be given to children identified at an early age. And today, as we are moving towards the World Health Bank's goal of reaching 1.5 billion people to the essential services, requires strong mindsets, big ideas, and right usage of resources with a great partnerships. And today we can see we have a global financial facility, and recently we had IMNCA conference from 25 to 28 March in Geneva, and we have the pandemic fund, which is the first multilateral fund for the pandemics, for the critical care in pandemic response, preparedness, and prevention. And also we have the fund for malaria, TB. Recently we had the World TB Day on March 24th, and it's according to this scheme, every year $5 billion will be released as a fund. And in this last year, 70 million people have benefited from this. 25.6 million people have been using antiretroviral therapy against AIDS. 6.5 million people have been used against TB, and 160 million insecticide nets have been distributed all over the world. And today we have the Gavi, the Vaccine Alliance. And today one of the remarkable steps recently, the World Health, all the organizations have declared and approved that HPV vaccine will be covered free under the UHC, and some governments are already starting this. And also today we have the intergovernment surveillance challenge of WHO is calling all the governments to come forward. And with all this today, I believe WHO is also united with the European Union to start the 5th UHC program for a sustainable development, a resilient growth, and a global stability. With all this, health is no more a dream, but it is a responsibility what we all should have. And today, I may not change, but we all can work together for the betterment of our Mother Earth. Jai.
అందరికీ నమస్కారం. సో ఈ రోజు మన టాపిక్ వచ్చి గ్లోబల్ యాక్షన్ ఫర్ యూనివర్సల్ హెల్త్ కవరేజ్. సో వాట్ ఇస్ దిస్ totally about? Today as a doctor, we not only treat the patients but also we see what the patients are suffering regarding the accessibility of their financial burden. So this global action on universal health coverage is basically about how are we going to make the health access to all the citizens of the world and also the country. So I would like to stress upon 6 main pillars on this. First is about the primary centers. First, the strengthening has to be started at the level of the primary healthcare centers so that accessibility can be very, very easily accessed for all the citizens of India near their homes. Next one is about the financial burden. there must be no additional pain suffering because of this financial burden. It will be only strong only when unless until there is no strong system support. The third one is the medicines and the vaccines. What is this medicines and the vaccines? There must be equal accessibility for all the medicines and vaccines without any racism or any other things that is going in the country. The fourth one is also about the telemedicine AI and its digital healthcare systems. Many people are telling nowadays that AI is going to replace the doctors. I would like to tell one statement. AI is not going to replace the doctors. The doctors will be replaced by the doctors who don't use the AI. So I request all the doctors also to have somewhat all knowledge about all this digital healthcare system. We have so many healthcare supporters who are in this field of digital medicine so that the healthcare is being accessible to all the public. And also the preventive support, the preventive and social community medicine where all the people have to go to the public and reach to the public and also know what we can do to prevent all the actions that need to be done in the society. The next one is the global action. What is global action? There must be support globally also from the World Health Organization and also World Bank and also UNICEF, all the things. All these are the sources where they give some sort of resources for the state and the country so that we can make much more stronger support in the country. We all have got a good lesson through the COVID also. What it has taught us, not everyone not safe unless until everyone not safe. It also taught us a lesson that the equality of healthcare access must be present at each and every level. And we also know so many good programs being organized by the government. For example, you can take Ayushman Bharat. Now, Ayushman Bharat, we have Pradhan Mantri Jan Arogya Yojana and also health and wellness centers. Many of the people are not aware of this. We have to reach the public, we have to speak with the public and also tell them what the resources are provided in the public. How many of them have yearly registered in My Bharat portal? That is the central government under the Ministry of Youth Affairs and Sports. It is a wonderful platform for all the citizens, especially to all the citizens, students here from almost from 15 to 16 years of age to 29 years of age. You all can get registered under the NSS or NCC or any other like. Every student of India have the accessibility in that portal. You can explore yourself as a citizen in all ways, in also in sports, in also culture, in also health. Health is wealth. So unless until we are not accessing all the platforms of the health, we will not be able to get what we are striving a lot today. So if, for example, you take in the same portal, we have Nasha Mukt Bharat, where lots and lots of studies and also lots and lots of programs is being organized to decrease all these things. And also we have TB Mukt Bharat, and also we have Khelo India. So all these things are not only in the books, it is also available in the digital platforms. Nowadays, the digital platform has become a very, very big thing in the society. So everyone, as doctors, we all need to know what is happening, not only in the medical college, we also need to explore ourselves. Unless until we go and reach outside, we will not be aware of what is going in the outside. And also I wanted to quote a small thing about Indian Medical Association. What is its role? They have a very good bridging platform between the policy and also the practice. They stand a lot on making the policies very, very strengthened and make sure that all the policies is being strictly implemented, and also the political involvement also has to be strong for making this health a very good well for all the people. So on this day, on World Health Day, I request all the doctors who are going to become very great doctors of India to strive a lot and work what is happening not only in your college and also come outside and work in the community and also see what is happening in the community. Prevention is better than cure. What I would like to say is prevention is the first medicine that you can give to any citizen as very, very big. Well, that is where you have strived a lot and we have given what we have become as a doctor. So with this, I would like to conclude and also wish everyone a very great World Health Day. Thank you so much.
Time starts now.
Respected judges, esteemed dignitaries, and my dear fellow participants, a very good evening to all of you. And it is truly an honor to stand before you today. Let me begin with a simple but an uncomfortable truth. Even today, the place where a person is born can decide whether they live or die. Not because we lack medical knowledge, not because we lack technology, but because we lack equal access to healthcare. And to truly understand this reality, let me take you through a moment that reflects it. A mother rushes into a hospital carrying her breathless child. Her eyes are filled with hope, but within minutes, that hope is replaced by fear. not because of disease, but because of cost of treatment. And in that moment, she is forced to make a devastating choice between her child's life and her family's survival. This is not just a story. This is the reality of millions, and that is what brings me to the topic I am privileged to speak on today: global action for universal health coverage. Universal health coverage means that every individual everywhere has access to essential healthcare services without suffering financial hardship. It sounds simple, also it sounds achievable, and yet the reality is so far from it. Many people travel hours just to reach a health center. Some people delay treatment because they cannot afford, and some they still never care at all. Not because their illness is mild, but because their circumstances are harsh. According to global health estimates, nearly half of the global population still lacks access to basic health services, and nearly 100 million people are pushed into poverty every year due to medical expenses. In India too, despite progress, access and affordability remains unequal, especially in rural and underserved areas. So the question is not whether we can achieve universal health coverage. The real question is, why is still healthcare a privilege when it should be a right? The answer lies in inequalities, gaps in healthcare systems, and lack of coordinated global health policy. We must focus on three essential pillars to achieve universal health coverage. First, strong healthcare system. Healthcare infrastructure from primary health center to tertiary health center, we must reach not only to the urban areas, but also to the most vulnerable population and to the last village. Second, financial protection to the patients. No one should ever have to choose between buying food and paying for treatment. Healthcare should save lives, not push people into poverty. And third, investment in healthcare providers. Doctors, nurses, and healthcare workers are the backbone of any health system. Supporting them means strengthening the entire nation. Encouraging steps are being taken. In India, initiatives like Ayushman Bharat under the National Health Policy framework aims to provide financial protection and strengthening the primary health care, reflecting our commitment towards the universal health coverage. Globally, there is a growing realization that health is not an expense, it is an investment. But policies alone cannot achieve this. As future doctors, our role goes beyond diagnosis and treatment. We are not just part of the system, we are the face of it. And every patient we treat with compassion, every community we educate, and every step and every effort we make towards equity brings us one step closer to the universal health coverage. Because health is not merely the absence of disease. Health is the dignity, health is the opportunity, and health is the foundation for better future. And therefore, universal health coverage is not just a healthcare goal, it is the moral commitment towards the humanity. Let us work towards a world where no one needs treatment because of poverty, where the health reaches the last person in the last village, and where health truly becomes a universal right. In the end, universal health coverage is not just a charity, it is the justice. The end of the day, health becomes accessible to every human being and each and every one. That day, medicine will truly fulfill its purpose. Thank you, everyone. Yes, sir.
Time starts now.
Good afternoon to one and all present over here. Respected dignitaries, esteemed members of Indian Medical Association, and my fellow competitors. I am contestant goal number 7. First, let me begin with a simple question. If you suddenly force you to speak ill today, what would worry you more? The disease or the cost of treatment? For the far too many families, the answer is not the disease, it is the bill. And when the bill becomes far more terrifying than the disease itself, we are forced to confront a world where the size of a bank account decides the length of your life. For millions, this is not a nightmare, it is their daily reality. A father should not have to question, can I afford the treatment for my child? A mother should not have to fear the joy of the life leading to a lifetime of death. No one should have to ever choose between saving a life and saving a life good. Healthcare must never be a privilege and should be protected as a right. As a former Director General of the WHO, Dr. once said, universal health coverage is the single most powerful tool the public health has to offer. It ensures that all the people have access to quality health services, preventive, promotive, curative, palliative, rehabilitative care without financial hardships. It rests on three unwavering pillars: that is, availability, affordability, and accessibility of these health services. And well recognizes under the Sustainable Development Goal of 3.8 for the aim of achieving the universal health coverage by the year 2030. To bridge this global gap, our primary healthcare stands as the first line of defense. It is where the diseases get diagnosed early, vaccination, maternal and child care. And it is where the diabetes, hypertension, malnutrition gets detected early before it becomes a disaster. It is not merely the first contact with the system, it is the strongest shield of our system. Yet, the mission is incomplete. Today, 4.6 billion people are still not fully covered by the essential health services. And in this battle, our public health sector must be a strong and a dependable foundation. Whereas our private health sector must be accountable and an ethical partner. And India is moving towards this horizon with a very clear strategy. To Ayushman Bharat, launched in the year 2018, and Pradhan Mantri Jan Arogya Yojana, providing a safety net of 5 lakh per family per year, now stands into the billions and the brink of the poverty. But true affordability also requires access to medicine. And this is where Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana changes the game. By providing the quality assured medicines at 50 to 80% less than that of the branded values, these Jan Aushadhi Kendras are proving that Sasta Bhi Bharose Mand Bhi is a true reality. Through Ayushman Arogya Mandirs, now healthcare is coming closer to the people at the village level. Combined with the e-sanjeevani, we are dismantling the geographic barriers to a secure teleconsultation. As the future doctor, our duty goes beyond this stethoscope. But true affordability also must never come at the cost of the quality. We must also remain vigilant against the counterfeit of medicine and unsettled practices. And in India, this is formed by Central Drug Safety Control Organization, the CDSCO, and Food Safety Security Authority of India, the SIMS&RF. Because in our field, prevention does not only cost money, it costs a life, a family member, a community. Our goal is one. Healing is where there should be everything available, because this universal health coverage is a moral promise. A promise that illness will never become poverty, a promise that healthcare will never depend on the patient's life. Then only we can truly fulfill the ways on which the World Health Organization was founded, that is, the attainment by all the people, the highest possible development. Thank you, Jai Hind, Jai Bharat.
Judges and respected dignitaries.
Be ready? Time starts now.
On the eve of this World Health Day, so I was very happy to stand in front of all the great visionary doctors and physicians who are here and to share my views and thoughts. So now I would like to tell few words regarding the global actions for universal health coverage. So I feel that I am the 8th speaker of this electrocution. Already 7 speakers are told about everything. So I will be briefing about only 4 to 5 points. So first one is strengthening of the healthcare system. Second one is accessible medicines and vaccines. Third one is affordability for the healthcare system. And fourth one is global partnership. So when we go in that, when we are trying to deal with this, everybody has spoken, but I want to give some solutions for the problems what we are facing. So what I really feel is, whenever we are going to strengthen the public healthcare system, we have to establish more of the hospitals and we have to establish more of training of healthcare workers. We have enough members, but the posts what we see at the rural health centers are very minimal. So we request that the government should encourage more doctors to do work at the rural area so that the burden on the tertiary care centers will be reduced. Because if some of the 80% of the diseases can be treated at the primary health setup itself. So whenever we focus on the strengthening of the primary health setup, especially the primary health center, community health centers, area hospitals, sub-centers, definitely the load on the tertiary care center will be decreased and the load and the tertiary care center will be for very rare diseases. In that way, the patient transportation, the patient time, the patient energy and the patient can be early diagnosed and treated at the early stage at the primary health setup itself. And the second one is accessible medicines and vaccines. So already in the previous speaker itself said that there was a HPV vaccine campaign, so polio vaccine campaign. So in these type of campaigns, when we are able to reach to the public, because I worked as personally for the Mission Indradhanush and Pulse Polio. So when I go to the tribal area, in tribal area till now we are having a superstitious belief that if we try to give a vaccine to some individual, the husband is not willing to give to the son. So we have to remove those superstitions and we have to give the education, that is called as medical education. When we are able to increase the education of the public and awareness, definitely we can reduce the disease burden and we can access, because our governments and our World Banks, everybody is providing the healthcare facilities. But to reach to the periphery, we as a physician should be able to, as MBBS graduates also, we should be able to increase the education and awareness regarding the services which are provided by the government. And another thing is, we also should have that of the medicines, essential medicines. Several things are available at the primary health sector, but when we are going to have some medicines which are not available, they are again coming back to that of the tertiary care center. When we are able to make available of essential medicines and vaccines and medical education is done, definitely then that will be a in that way definitely we can reduce the disease burden to the tertiary care center, and this is the way the periphery rural setup we can increase the health status of the individual. Why I am talking more on the rural India is 80% of the people live in rural India. So that's why whenever we are able to strengthen the rural India, automatically the health status of the India can also be improved, and our human development index in the world rankings can also be improved. This is the one thing. And what I really believe is, whatever Pradhan Mantri always says is, you think globally, act locally. Whatever you think globally, you should act locally. You go to Singapore, you go to Taiwan, you go to Thailand, any country, you adopt several systems, but you should finally adopt to our Indian system, and it should be like tailor-made to the Indian systems. And like example is Delhi system, what they made as a Mohalla clinics. In our state, we have village health schemes. So in those sites, when we are able to do that, we will be definitely improving the health status of India. With the last slogan, I conclude my speech that Cherire Jejjare Pude Vyadhigraste Kale Kare Aushadam Jahnavi Toil by Joe Narayana. So whenever we are able to communicate and whenever we are as a physician, whenever we are able to increase the medical education and awareness to the public, definitely we can improve the health status of our country. Thank you one and all.
Time starts now.
Yes, namaste to all the dignitaries and the audience who are present here. Firstly, let me wish you World Health Day. So this is being celebrated as daily awareness regarding the health in all the people. So what is the meaning of this universal health care? So this means that giving the assurance to the people who are in need. We have to give the medicine or the health aspects which are accessible and affordable to all the people. So there are some monitoring programs which have been stating that 4.5 billion people, they are not getting the proper healthcare services. 2.1 billion people, they are facing financial hardship, and 1.6 billion people, they are thrown into poverty because of the medical expenses. Our healthcare system is mainly having two dimensions.
One is healthcare delivery system. Next, number 2 is healthcare payment system. Healthcare delivery system, what are the global actions which can be taken to improve the healthcare delivery system? First one is we need to build up a strong healthcare system. Here, the main role will be played by the governments. So they have to allocate the main part of their budget to improve the healthcare infrastructure. So they have to develop the infrastructure in the hospitals. So not only developing the infrastructure in the hospitals, they should make the awareness about the services which are available in their hospital. Just by improving the infrastructure does not mean that will not reach to the people. So the same thing happened in State Cancer Institute, which I know. So there is a infrastructure is very, very good. High-end instruments are available there, but the awareness is not there for the people that the service is available in that institute. For that purpose, what they have done is they have made some reels, short videos regarding the services which are available in that hospital. So thereby they are creating the awareness about the services which are reachable to them. Next thing is we have to empower all the individuals, families and communities. They have to come voluntarily and take care of their health. So there should be global collaboration which will be done by the WHO. Next is we have to concentrate on preventive medications, preventive medicine. That is, we have to be emphasizing on the vaccination aspect. We have to create the awareness to the people regarding the surge of non-communicable diseases. Already the governments have started their actions and there is decline in the infectious diseases, but there is surge in the non-communicable diseases. So this is allowing the importance of this action which need to be focused on non-communicable diseases. So this can be mainly done by creating the awareness regarding the diet. So what is the diet we are taking? So already our government is taking eat fit. We have to eat what is healthy. Next thing is we have to concentrate on sleep, which is the most the thing which is being neglected by most of us. So sleep also plays a very part in the health aspect. And along with it, we have to include physical activity in our daily lives. So all these together, if we create awareness in the people, this can minimize the incidence of non-communicable diseases. So this is a dimension of healthcare delivery system. When we come to the healthcare payment system, the governments have to emphasize or formulate certain policies, and they have to give some health insurances for emergency health services. And very important thing is there should be price regulation for the medicines and also the treatments. So all the areas in the country, they should have the same cost for any treatment. So that should be regulated by the governments. And now, dear all, don't think that universal healthcare achievement is the responsibility of the government, but it is an individual responsibility too. So we have to concentrate on our own health. So what are the dimensions on which we have to concentrate? We have to concentrate on physical health, mental and emotional health, spiritual health, social health, and we have to concentrate on occupational health, environmental health, and finally financial well-being. We have to concentrate on the savings. So this should be the holistic approach of healthy well-being. So after this individual responsibility for the achievement of universal healthcare, what is my role? What am I doing for achieving the universal healthcare? So myself, I have taken a part in this social medicine. What does it mean by social medicine? Taking the health into the society, the basic aspects of the health into the society. As a part of this, what I have done is I have started giving radio talks. So in the language which is feasible for the patients or the people living in the rural areas. So I have selected a topic like recently I have given a talk on sleep hygiene, which no one is familiar about and who will not care much on the sleep. So I have given a talk on that which has reached the rural population in my area, and I have got a positive feedback that they got awareness of importance of sleep. And also not only this, as a part of the social medicine, I have been to the schools and I have educated the children about the basics of health. What does it mean by personal hygiene? What is the basic aspect of the health? What is the importance of sunlight in a daily life like that? I have concentrated on the basic health aspect. So the children, they carry the information to the adults in the home, and that information information can be spread from one adult to the other. So thereby I am trying to contribute myself in the coverage of universal healthcare. So thank you one and all for giving me this opportunity. I would like to conclude with just one single statement. Global health today. So it is very important. So getting the healthcare is not a privilege, it is a right. Thank you, sir. Thank you.
12 kilometers, carrying her feverish child through the night. And when she finally reached the hospital at dawn, the doctor looked at her gently and said, "Treatment is available, but can you afford it?" That moment, when illness meets a wallet, is where humanity quietly fractures. And that fracture is exactly why we gather today to speak about universal health coverage. World Health Organization tells us something both hopeful and heartbreaking. Nearly 4.5 billion people still lack access to primary health services. And every year, over 100 million people are pushed into extreme poverty simply because they fell sick. Think about that. Not because they were irresponsible, not because they were careless, but because they were human enough to get help. Health, after all, is the only wealth that doesn't ask for any proof of income. UHC, or Universal Health Coverage, is a simple promise with profound meaning. Everyone, everywhere should receive the healthcare they need without suffering financial hardships. No fear at the pharmacy counter, no hesitation before entering a hospital gate. No family forced to sell land, jewelry, or dignity to survive. But reality often whispers a cruel sarcasm. We live in a world where robotic surgeries exist, where artificial intelligence predicts diseases, and where space tourism is becoming real. And yet, somewhere someone dies because they could not afford antibiotics costing less than a cup of tea. This is the most sophisticated irony of modern civilization. But hope is not absent. In 2023, the world witnessed a historic step when the United Nations reaffirmed global commitment to universal health coverage (UHC), urging countries to strengthen primary health systems and ensure equitable access for all. Here in India, initiatives like Ayushman Bharat aim to provide primary health protection to millions of vulnerable families. These kind of efforts remind us that progress is not a miracle, it's a collective decision. Because healthcare is not merely about hospitals, it's about justice. Yes, justice when a farmer receives insulin without selling his harvest. Justice when a child with pneumonia receives oxygen before it's too late. And justice when a grandmother walks into a clinic with dignity instead of fear. Allow me to pause with a small reflection. Across the world, one truth we see: health is the root of dignity. If hearts unite and systems care, healing can bloom everywhere. Universal health coverage is not a charity. It's not a luxury, it's not a political slogan. It is a mirror. Yes, it is a mirror that asks us what kind of world are we building. One where medicine advances but humanity lags behind, or one where science and compassion walk side by side. Because one day, each of us will stand in those quiet hospital corridors, not as speakers, not as judges, not as policymakers, but as patients. And on that day, the only question that will matter is simple: will healthcare be a privilege or a promise? Global action for universal health coverage is choosing the promise. Not tomorrow, not gradually, but now. Because a healthy world is not built by doctors alone. It's built by our shared decision to care. Thank you one and all, and happy World Health Day.
Teachers, and my dear friends, today I stand in front of you to speak on a topic that goes beyond medicine, beyond statistics, and beyond policies: universal health coverage. But before I begin with definitions and data, I would want to take you all to a moment that changed the way that I look at healthcare forever. A few days ago, during my clinical postings, I saw something that I will never forget. An elderly man was sitting quietly on a hospital bench. His reports were in his hands. The doctor had advised him further investigations and treatment. The treatment was possible, the prognosis was hopeful. But the man was not asking about the side effects. He was not asking about the survival rates.
he only asked one question. Doctor, how much will it cost? There was a long silence in the room because at that moment, the real diagnosis was not just healthcare, it was affordability. It was affordability. Healthcare is just about medicine and the privilege of people getting the adequate treatments without any financial hardships. It is about access, it is about dignity, and it is about justice. Universal health coverage, strongly advocated by the World Health Organization, means that all people receive adequate health treatment without any financial hardships. Not just the rich, not just the urban, and not just the insured, but everyone. Yet, the reality is quite harsh. About 4.6 billion people lack essential healthcare services, 2.1 billion people face financial hardships, and 1.6 billion people are pushed into poverty. But there is still hope. Through initiatives like the Ayushman Bharat and Pradhan Mantri Jan Arogya Yojana, the government is providing healthcare insurance coverage up to ₹5 lakhs per family to help billions of vulnerable citizens. And the Andhra Pradesh government has taken certain remarkable steps in strengthening of these policies through the initiatives like the Dr. ISR Arogya Shri scheme, which provides financial help to billions of people through which they can attain healthcare services for serious illnesses and The universal health coverage stands on 3 pillars. First, accessibility. Second, affordability. And third, quality. Thank you.
Okay. Time starts now.
Good afternoon, respected judges, dignitaries, and everyone present. Let's imagine a moment. A young girl who meets an accident is rushed to the ICU. Her mother waits outside, anxious and waiting for a miracle to happen. Doctors are ready and the treatment exists. But before anything can start, one small question asks her mother, "Can you afford it?" At this moment, healthcare is no longer a right, but it becomes a privilege for a few. It is not a question about money, it's a question about life itself. Many have experienced this personally during the pandemics when we lost our relatives, our close friends, not because treatment didn't exist during that time, just because it was not accessible at the right time. And this is exactly where universal health coverage steps in, not just as an option, but as a true necessity. So today I stand before you to speak to you on the topic, Global Action for Universal Health Coverage. Universal health coverage, as defined by the WHO, says that everyone, everywhere, receives healthcare that they need without any financial hardship. There are 3 essential pillars for the universal healthcare. First is service coverage, second is financial protection, and third is equity. Because healthcare delay is often life denied. Everywhere, millions of people are pushed into poverty because of the medical expenses. Many have to sell their homes, many fall into lifelong debts, and many never even seek treatment. And that is why this topic, the global action for universal health coverage, is very much critical. At the global level, this has been taken as a top priority under the United Nations Sustainable Development Goals. In our India, national schemes such as the Ayushman Bharat, the National Health Mission, and also the Jan Aushadhi scheme has also been included. But yet there are certain challenges which still remain, such as the rural healthcare gaps, the workforce shortages, as well as the rising costs. But there are clear steps which can be taken to bridge all these gaps and make us come more closer to the universal health coverage, such as investing more on the primary and the rural healthcare systems, training and supporting the grassroots level workers such as ASHA workers, Anganwadi workers, the ANMs, making diagnostic services and the medicines more affordable, especially making the medicines available at the doorstep, especially for the poor people who cannot come to the hospital, people with disabilities. Also utilizing the telemedicine, which is very much evident nowadays, to reach the remote areas. And finally, focusing on prevention and awareness about recent treatment modalities so that the patients can reach the right place at the right time to receive the treatment. So I conclude my speech over here by telling that a society is as powerful as its weakest patient. Health is not charity. Health is not privilege. Health is a fundamental human right. And until everyone has access to it, our job is not just done. So let us come together in the coming days to build a future where healthcare is not mere a privilege, but healthcare becomes accessible, affordable, and equitable to all. Because when we protect health, we protect humanity itself. Thank you.
So before the final results are announced, we will give the journal awards. We will give the journal awards to save time. Okay. Andreas, Srikari Andreas, Rao Garu Andreas, Coach Garu Andreas. Hello, wait for a few more minutes. Enjoy your friends receiving their medals. Encourage them. I think you are in a hurry to get out. 4 o'clock is already over. Your time is up. Another half an hour. Okay, Zone 1 winners, journal level. First place goes to MSC Vaishnavi. Zone 1. Officer are to give the prizes. Certificate, a medal, a pen, and a keychain. Certificate, medal, a keychain. Then, now, keychain.
Okay, ready, sir?
Second place.
Sir, ready, sir? Ready, sir?
Jaran Varghese, okay, congratulations. Okay, move. Happy. Third place, Pawan.
Okay, ready, sir? Sir, look here.
Pawan Datta, third place. A medal, a pen, certificate, and a keychain. Second section, Nagaraju. Dr. Nagaraju from Pittsburgh. You want to first place, Ramasai. You want to Dr. Sangvi. Ready, come. Safety, closing.
Ready, sir? Yeah,
Third place, Jackie Singh. Home down. Special appreciation, Currency. You are lucky to get the medal from your own family members.
Madam. Put up. Ready. Okay.
Zone 3, first place, Uma Maheshwari. Zone 3, first place. Zone 3, second place, Karthik. Zone 1 అంటే శ్రీకాకుళం, విజయనగరం, విశాఖపట్నం, ఈస్ట్ గోదావరి. Zone 2 అంటే వెస్ట్, కృష్ణా, ఒంగోలు. Zone 3 అంటే నెల్లూరు అండ్ రాయలసీమ. కార్తీక్. Third place, Sai Sangeet. Appreciation, Sai Saru. Usha from Kakinada, Ayush Sharma from Visakhapatnam, Purvi from Vijayanagaram, Yashwardhan from Kakinada, Sai Vishnu from Pinnamaneni. I think one of you can take it, Pinnamaneni. One of you can take a friend of Sai Vishnu. Okay, Nagishav, let's go. Varguna Sai, Masipatnam, Shahul Hamid, Vijayawada. Okay. And Varguna Sai. Varguna Sai kan? Renuka, Anjali, are you here? Yes. Renuka, Anjali. participated in the e-poster contest. She got the second place. She could come to the stage and again, no home now.
Ready, sir. Sir, ready, sir?
Okay, sir, put your documentation. I just this is take your seat. I'm happy to announce that the first place in the final round goes to 1 second. Okay, number 12, Shara. Shara is from Zone 1, Kakinada. He got the highest marks.
Okay, ready, sir? Welcome.
And second, third, fourth, they got equal marks. That is number 3 is I. No problem. Doesn't matter. Is I
Okay, ready, sir?
Sai from
Sir, ready, sir?
Nellore. Narayan Medical College. Yeah. Third place. Do it again.
Okay, ready, sir?
Special appreciation number 10.
Okay, ready, sir? Okay, ready, sir? Okay.
And put your appreciation. And we should not forget the judges and our sponsor. Isn't it? So, what is our
Okay, ready, sir?
All of you know Dr. M.S.C. Bose, M. Subhash Chandra Bose, is our state secretary, and he is a very dynamic personality, a committed worker of IMA district. He has been continuously guiding me, and he is a deputy for all the activities. Not only for earlier e-courses also, all the 3 rounds, 4th round. That is 2 plus 3 plus 1. 6 rounds he is the deputy. Meticulously managed and guiding us. So, a small
Sir, ready, sir? Okay.
Another dynamic personality, a governing personality, heading the medical council, AP Medical Council, Dr. Srihari, is kind enough in his busy schedule to be here with us and he came. Small moment to review on behalf of the state and also Pinnamaneni.
Ready, sir? Okay.
Not but not the least, another knowledgeable person, a humble worker, knowledgeable man, much interested in propagating scientific medicine, served as president of International President of Market International, and a good active member of IMA at Vijayawada, conducting weekly webinars since many weeks on an important topic. That is none other than Dr. M.B. Rao. A small moment to you, sir.
Ready, sir? Okay.
In absentia, we acknowledge the services of Dr. Ravi Krishna for being a gift for the Zone 3, and also Dr. Sri Srinivasaraju being a gift for Zone 2. So, once again, I thank all of you, and anybody else who has rather here for a particular and Zone 1, V.S. Prasad, I forgot. Dr. V.S. Prasad is a past president of IMA State and also Dean of IMA CTP last year. Another committed leader, a committed worker, and knowledgeable person of IMA. So thank you very much. So finally, I once again thank, I purposefully did not talk about the principal person in the earlier talk. So, he is Bhima. Bhima means very powerful person. So we are here right now, we have Bhima in front of us, and we have all the power in service for him. Thank you very much, sir, for all your support. And with the one circle, we have this much of crowd, and we are very, very happy. All of you definitely please follow, participate. Winning or not winning is judgment matter, but participation is very, very important. That makes you more confident in your exam, in your future life. All the best to you, all the best to you, all the best to you. Thank you very much.
To all the people who got the medals and the results of this program. It seems there is a special felicitation for all the people on the dais Then Dr. S. Director General of Dr.pinnamaneni, District of Data Sciences. Sir, thank you very much for your kind cooperation and humility. You have done everything and you served very good food also to all of us. Thank you very much.
మీరు చెప్పండి అంతే, మీరు చెప్పండి. అందరికీ వేసిన ఎలా నో ప్రాబ్లం. ఫస్ట్ వాళ్ళు పెట్టుకోవచ్చు, ఎవరు కనబడితే వాళ్ళే పెట్టుకోవచ్చు. మీరు వేసేయండి, మీరు వేసేయండి. ప్రెసిడెంట్ గారు రండి.
రెడీ సార్?
Today's president.
Ready sir, ready sir. Okay.
Next Dr. Bhoskar.
Sir, ready sir? Okay.
Dr. Sishari.
Ready sir, ready. Okay.
Dr. Subbareddy garu, your August presence, you are welcome. President of Apna, MCA, a member of MCA. ABM, sorry, MCA, ABM.
మీ నోటితో ఇలాంటి పెద్దవాళ్ళు ఆశీర్వాదం.
Dr. Ram Prasad, please, Vice President. Okay, namaskar. Thank you very much. Last name.
And that is wonderful year.
Ready sir, ready sir?
The second one I am receiving from Pinnamaneni.
Okay.
Okay, all is well and ends well. Thank you very much. Bye bye. Sir, is meet every meeting.
సార్ ఒక్క నిమిషం నుంచోండి సార్. సార్ నుంచోండి, అందరు నుంచోండి సార్. వెళ్ళండి సార్, వెళ్ళండి.
Okay, ready sir? Sir, ready sir? Sir, one more sir. Okay.
నేనేం చేయలేదు.
మేడం సార్,
నీకోసం ఉంది.